So now I'm going to turn it over to the hot topic of diet and exercise to Dr. Poorvu. Again, Dr. Poorvu is one of our medical oncology collaborators who is working with us to help understand more about these risk factors, which are in fact modifiable, but sometimes hard to change, we know.
Great, thanks, Terry. All right, well, good morning, everyone. I'm Phil Poorvu. I'm a medical oncologist here at Dana-Farber, focusing on breast cancer, and absolutely thrilled to be here today to discuss lifestyle-based breast cancer prevention. So much of what we do as patients and doctors focuses on responding to disease. And so it's fantastic to have resources like BPREP in this forum to try to shift that focus towards prevention. And within prevention, to a great extent, we focused on lifestyle factors. And I'll talk today mostly about diet and exercise, but of course lifestyle extends beyond diet and exercise to other aspects of life, including sleep and stress, which can also have important implications on health overall. But I think largely because diet and exercise feel like things that we can modify, right? We make dietary choices on many times a day, that it's gotten much attention through research and certainly far more attention in the media. And sometimes that volume of information can be challenging to navigate. So diet and exercise recommendations are everywhere, right? And one challenge is that they don't always agree. In fact, they often disagree. So in preparing the slides today, I Googled two of my favorite foods or drinks, tomatoes and coffee, right? And if you look at tomatoes, on the one hand, they are the number one food to cause cancer, right? And then on the second website, Googling tomatoes and cancer, they're a rich source of nutrients that can be used to fight cancer cells and they can be incorporated with other cancer treatments, right? Similarly with coffee, you can detoxify your way to a healthier you through coffee. I've incorporated that wholeheartedly. And on the other hand, coffee contains a substance that has been labeled a carcinogen, right? So how can we reconcile these differences? How can we sort out fact from fiction? And today we'll talk about how the research is done to try to help figure out what we can pay attention to and maybe what not to. So we'll discuss whether there's an optimal diet to prevent cancer and how weight and exercise affect cancer risk as well. So most studies looking at the links between diet and cancer are through observational studies. And by that, I mean there's a group of participants who are included in the study. They might be eligible on the basis of one or a number of factors. Today we're talking mostly about diet and breast cancer risk. So maybe they're eligible on the basis of their age or their menopause status or family history of breast cancer. And then they're followed over time. And we evaluate the dietary exposure. So they might fill out a survey that asks them about all of their dietary, all of the things they consume in their diet. This is often through something called the food frequency questionnaire, which we'll look at next. And then participants are followed to see if they develop the outcome of interest, here being breast cancer, but sometimes other diseases as well. And this is a different study design than what we often use in cancer research, a randomized trial, right? In a randomized trial, there are participants who are eligible, and rather than just being followed over time, they might be randomized, meaning that a computer selects what intervention they get. Do they get diet A or diet B, drug A versus drug B? And then they're followed for the outcome. So again, most of the studies looking at the links between diet and cancer are from observational studies, and there are some real benefits to this approach. We can ask many women at one time about their dietary choices, and we can follow many patients over time. We can evaluate many different foods at one time. And we can look not just at breast cancer risk, but other cancers and other aspects like heart disease. One challenge is that if we're asking about so many different factors, it can be hard to determine which is the factor that's actually relevant, right? And I'll try to demonstrate that next. One challenge of a randomized trial is that these are really expensive studies to run, and they really isolate the difference between diet A versus diet B, but it doesn't necessarily isolate. You can't really evaluate all the different factors at play. You're really selecting two things to look at. So here's a food frequency questionnaire from the Nurses' Health Study. And I'll just speak briefly about the Nurses' Health Study. This is one of the largest epidemiological studies that we have to date and one of the most important ones that have evaluated the impact of diet and exercise on cancer risk, heart disease, and other important health outcomes. Nurses Health is actually run out of Brigham and Women's Hospital and from researchers at Harvard. And over the course of the decades that this study has been going on, nearly 300,000 participants have been evaluated. And so here's the food frequency, or part of the food frequency questionnaire that participants get. This is just the section on fruits and vegetables alone, right? And so this is really comprehensive. And you can imagine that if you're trying to determine if risk of breast cancer is isolated to one food, it's going to be challenging to understand if it's the cantaloupe. I don't know if you can see this as well as I can. It's the cantaloupe or if it's the cabbage and coleslaw, right? Because we're asking about so many different factors. And so as a result, we have probably more data rather than looking at the individual foods, but maybe at types of foods over time, right? So in the early 1990s, through Nurses Health, we learned that red meat has been linked to colon cancer risk. And in that study, the participants who had the highest amount of red meat consumption had about twice the risk of developing colon cancer as the participants who had the lowest amount of red meat consumption. And that's been borne out in other studies as well, and has led to recommendations and guidelines to moderate red meat consumption, really to maybe less than 18 ounces per week or so, right? One of the most interesting stories in epidemiology over time, I think, has been the impact of smoked and processed meat. So we learned that as refrigeration became more widely available decades ago, that rates of stomach cancer decreased fairly dramatically as the reliance upon using smoking food to store them went down. Potentially the most important dietary risk factor that's established with cancer risk is alcohol. And alcohol has been linked to the risk of several different cancers, including cancers of the head and neck like tongue or throat cancer, cancers of the liver, esophagus, and breast cancer as well. And it really appears that, particularly in terms of breast cancer risk, what seems to be most harmful is excessive alcohol. And so we recommend that patients consume essentially no more than 1 drink per day on average, right? Lower levels of alcohol use have not been associated with greater risk, but it seems to be that the higher amounts of alcohol over a long period of exposure have been associated with risk. So what I tell my patients is it's okay to have 2 drinks on a given day, but really we're thinking about long-term exposure over time and trying to limit that to less than 1 drink per day on average. So we hear about many studies in the media about the direct effect of a particular food on cancer, right, like tomatoes or coffee. But for the most part, those studies were done using cells in test tubes or in animals rather than people. So I wanted to go through that fairly quickly. So let's take broccoli and breast cancer. So this has been praised as a food that contains compounds to prevent cancer. And so let's look at how the studies were done. So essentially what happened is breast cancer cells were grown in a lab in a test tube. Nutrients were isolated from broccoli and exposed to those breast cancer cells at varying concentrations. And at the highest concentrations, the growth rate of the breast cancer cells slowed, and the cells seemed to die at a higher rate. Those same nutrients were tested in rats as well. So they took young female rats and they divided them into 2 groups. Some were given food that contained the broccoli nutrients. Some were given just the normal food with no broccoli nutrients. All of the rats were exposed to a chemical that causes breast cancer in rats. And the group of the rats that had gotten the broccoli nutrients were about half as likely to develop breast cancer. But we know through lots of cancer research that what happens in a petri dish or in a test tube can be far different than what happens when we use the drug in humans, right? And that's what we care about here. So what about in people? Where's the evidence for broccoli in humans? We have no studies testing what happens among women who have breast cancer and then increase broccoli consumption. None at all. We have many studies like Nurses Health that have asked women who don't have breast cancer about how much broccoli they consume, along with other fruits and vegetables, to determine what the risk is over time. But really the results have not been very consistent. Some have shown maybe a slightly lower rate of breast cancer in women who ate more broccoli, but you can imagine that a woman who eats more broccoli might be more likely to eat more cauliflower, right? And they might be more likely to eat less red meat or to exercise more. So again, isolating that one factor can be a challenge. And overall, my impression is that there's no clear association between broccoli itself and breast cancer risk, but maybe a source maybe when we think about the diet as a whole, that might be more relevant. So the Women's Health Initiative Low-Fat Diet Study is worth talking about. This was a large trial designed to test the effect of a low-fat, high fruit and vegetable diet on the risk of developing breast cancer, colon cancer, and other cancers. And so in this study, all participants were women who had gone through menopause, and they selected a group who had a fairly high proportion of their calories that had come from fat. So at least 32% of calories were from fat in their diet as they entered into the study. And then they were randomized to either have their usual diet or to switch to a low-fat diet. And in the low-fat diet group, they were counseled to decrease their fat consumption to no more than 20% of the calories they take in, and to take at least 5 servings of fruits and vegetables per day. Whereas the women in the usual diet group were instructed not to make any changes, right? This is a really large study, nearly 50,000 participants, and that's truly remarkable. These are challenging studies to run and to randomize that many patients, so a great source of data in an important study. So one important question is, are patients able to change their diet when they're asked to? So in the low-fat diet group, they cut the fat they ate by about 13%, and they ate 1.5 more servings of fruits and vegetables per day, whereas the usual diet group essentially ate the same diet over time. Does it make a difference? Overall, the risk of developing any cancer was essentially no different between the two arms. The low-fat diet group had a slightly lower risk of developing breast cancer, but that risk was really quite small, and I think so small that we can't really say it's a meaningful difference. So another study looked at whether eating a Mediterranean diet affected the risk of developing breast cancer. The Mediterranean diet has gotten a lot of attention over the past 1 or 2 decades as a diet that might be associated more with a lean body weight and a way to lose weight. It's characterized by having lots of vegetables and fish and olive oil, a limited amount of red meat and processed foods, and a little bit of wine. So in this study called the PRIMED study, the main goal was to evaluate the impact of a Mediterranean diet on actually the risk of developing heart disease. But the investigators also looked at the impact among the women who had participated in the study on the risk of developing breast cancer. And the participants were divided into 3 groups. 2 who took a Mediterranean diet, one with olive oil, one with more nuts, versus a usual diet group, and that group was counseled to have a low-fat diet. This was a smaller study than the Women's Health Initiative, about 4,000 women who took part in this study. And so the diets make a difference. Well, it was somewhat challenging to determine because, thankfully, a relatively small proportion of patients developed breast cancer, 35 out of the 4,000 women who participated. Overall, there was a lower risk of developing breast cancer in both of the groups that took the Mediterranean diet, 62% lower relative to the usual diet group among the participants who had the Mediterranean diet with olive oil, and 38% lower with the Mediterranean diet with extra nuts. So summing up the research, I think overall the studies show benefits for many different diets for cancer prevention, low-fat, low-carb, or a Mediterranean diet. But really, I'm not so sure it's the specific foods within each one that are important, but rather the things that they have in common. They're high in fruits and vegetables and fiber, less red meat and processed foods, and a limited amount of alcohol. So really, going across the board, research has not shown that there's any one superfood that you have to eat a ton of. I tell my patients all the time, if you love eating kale, absolutely fine to do it, but the research doesn't support that it's going to help to prevent breast cancer in and of itself. And likewise, there's no food that you have to cut out of your diet entirely. I think some exceptions to that are alcohol, which we talk about limiting, not necessarily cutting out entirely. I get lots of questions about soy. I think there's no research showing that you have to cut soy out of your diet entirely. I think probably wouldn't make it the mainstay of every meal, but I think soy in moderation is probably fine as well. But we know that diet is just part of the equation, and I think this is an important equation. So we think about calories consumed through the food we take in versus calories expended through exercise and baseline metabolism. And the difference between the two ultimately represents change in weight over time. And each of these factors have been linked to cancer risk. We have more than 100 studies demonstrating an association between regular exercise and cancer risk. The research has been strongest linking regular exercise to breast cancer and colon cancer, with about a 30 to 40% lower risk of developing cancer among participants who exercise regularly. So what types of exercise were people doing in these studies? I think somewhat reassuringly, the most common exercise was walking at a moderate pace, maybe of about 3 miles per hour for about half an hour per day. And I think that's good news, because even for people who are fairly sedentary, I think most people could find that getting to walk half an hour a day is something that could be feasible, maybe even if not now, but with time. So I usually tell patients, you don't have to go from 0 to 60. It's okay to work up slowly. Really, to find a strategy that is sustainable over time seems best. So even if you have to do, break that 30 minutes up into 10-minute sessions, and then 15 minutes, 20 minutes, and then 30 minutes over time, and I think the data support that. It's not necessary to run a marathon. I think a small proportion of people find that setting a really intense goal can be helpful for motivation, but the data support that you don't have to go for that super intense strategy. And here are the data looking at regular exercise when we accumulated data from many different studies together. So the way to read this figure on the right-hand side is that if the square is closest to the vertical bar, that means there's no difference in cancer risk. The further to the left the square is, that indicates a lower risk, and to the right, a higher risk of cancer. And you can see that for the across the vast majority of these cancers listed on the left-hand side, the risk seems to be lower among participants who exercised regularly. And for patients or participants with breast cancer, regular exercise lowered breast cancer risk by about 10%. The group that had maybe a slightly higher risk of cancer, or the cancer that was associated with a slightly higher risk, was melanoma. And you can imagine that people who exercise regularly might have more sun exposure. And I think that highlights the need, although this isn't the focus of the talk today, to incorporate sunscreen into lifestyle as well. So what about weight? I think we've all seen these figures before, demonstrating the changes in the prevalence of obesity over time in the United States, which has become more and more common. We have many studies showing that heavier individuals are more likely to develop cancer. And so these are data from our most prominent medical journal, looking at the risk of obesity compared to participants who had a normal body weight with a BMI, or a body mass index, of 18.5 to 25. When you looked at the risk of developing any cancer, participants who had a BMI above 40 had about an 80% higher risk of developing any cancer. And with breast cancer, with a BMI above 40, the risk was about twice as high. And for lower levels of being kind of overweight or obese, there was also a higher risk as well, somewhere about 30 to 80% higher. So I think the most important question is, does weight loss help, right? Because at any point in time when you're trying to make decisions about weight loss, everybody comes to the table where they are and they're thinking about making change, right? The best evidence that we have comes from people who underwent bariatric surgery, things like gastric bypass or the lap band procedure. And somewhat remarkably, among patients who underwent these surgeries, the risk of developing cancer fell by about 40%. And the cancers that were most reduced were cancers of the uterus, breast cancer, and colon cancer. So clearly, bariatric surgery is not right for the vast majority of people, right? It's a fairly drastic step to take, and most people aim to lose weight through diet and exercise. So where are the data here? Unfortunately, we have fairly few studies in which we have examined weight loss over time that has been sustained, and we've evaluated for the impact on cancer risk. From the Women's Health Initiative study, which I talked about earlier, we found that women who cut weight on purpose did have a lower risk of endometrial cancer or cancer of the uterus. But clearly more information is needed about the effects of losing weight through diet and exercise on cancer risk. And I'll talk later this morning, about the study that we have ongoing here. So a few conclusions. We know that exercise, weight, and diet through a number of studies are linked to the risk of developing breast cancer and other cancers as well. We believe, and I think the data really support, that a healthy lifestyle is an important part of a cancer prevention strategy. But clearly more research is needed to understand to what extent the rates can be reduced through diet and exercise. So with that, I'll pause.
We're going to get started. Okay, so Phil is going to share with you a very exciting study that we have ongoing, looking at exercise intervention for women with dense breasts.
Excellent. Thanks, Terry. I actually prefer Phil. Unfortunately, I get Dr. Phil a lot, who's become my arch nemesis, but Phil works. So Terry did a great job of describing the issue of breast density earlier on, really with, the way I think about it, two main issues of relevance. One is for breast screening and the sensitivity of mammograms, and then for really the smaller proportion of patients with extremely dense breast tissue, considering risk as well. So we have two studies that we'll discuss today that are ongoing, looking at women who have dense breast tissue, and the one that I'm going to talk about is an exercise study for women with dense breasts. So we know, as I talked about earlier, that women who exercise regularly are at a lower risk of breast cancer. But the question is, how could exercise work in preventing breast cancer? What are the actual mechanisms at play? And so we've done some work here. Dr. Ligabel at Dana-Farber has done lots of work exploring this issue. And we've learned that exercise has many effects on hormones that have been linked to breast cancer. So this is some background information. The Dana-Farber exercise and insulin study enrolled breast cancer survivors who were not exercising regularly. And they were then assigned to either an exercise intervention or a usual care group. And the exercise program consisted of a strength training program and also doing some cardiovascular exercise at home. And they took blood, and they found that the participants in the exercise arm had lower levels of insulin, which is a hormone that has been linked in other studies to breast cancer. They took this a step further through the preoperative health and body study, in which patients who were newly diagnosed with breast cancer were enrolled. And in the time before they underwent breast surgery, they got a baseline biopsy and blood was taken. They participated in a brief exercise program in one arm or a mind-body program in the other arm. And then they went on to have their breast surgery, which had been otherwise scheduled. And the goal here was to test how exercise affects breast cancer cells, because we have the pre-exercise biopsy and the post-exercise sample from the surgery. And what did the study show? It showed that exercise lowered the blood hormones linked to breast cancer. Interestingly, and hopefully not surprisingly, the mind-body program reduced stress and anxiety, which is good information. The exercise arm had increased action of the immune system in the breast cancer tissue itself, so there were more immune cells. And the question is, or the suggestion would be that maybe this was early evidence that exercise helps the body to fight off cancer through activation of the immune system. So this study that's ongoing is an exercise study for women with dense breasts. It will include 60 participants who are premenopausal and have increased breast density. And so Terry had mentioned that there were 4 categories of breast density, and the participants for this study have either heterogeneously dense breast tissue or very dense breast tissue. They undergo, and they don't have breast cancer, right? So they undergo a biopsy of benign breast tissue, and a blood sample is taken. They then undergo a 12-week exercise intervention, which I'll describe in a moment. Then they have another biopsy and blood sample collection after that 12-week intervention. So who's eligible? Again, this is all premenopausal women. They have dense breast tissue on their mammogram, either heterogeneously dense breast tissue or extremely dense breast tissue. They're not exercising regularly at the time that they enroll in the study. They have no history of breast cancer and aren't actively taking an oral contraceptive pill. So what does the exercise program look like? It's a 12-week program, and they have 2 weekly exercise sessions with a trainer, and they're also instructed to do some additional home-based aerobic exercise. All the participants get a Fitbit, they get to keep it, and they get a gym membership for the 12 weeks at a YMCA. And the goal is to do a total of 220 minutes of exercise per week, 180 minutes of aerobic exercise, and 40 minutes of strength training. Because there's 2 60-minute episodes with the coach, that accounts for 120 minutes, and then participants aim to do 100 minutes at home on their own. So what does the study involve? There's a biopsy that's collected, through a needle with ultrasound guidance, both before and after the exercise intervention. That biopsy is timed with the menstrual cycle. We measure height, weight, waist and hip circumference. And then we evaluate the exercise that participants are doing through questionnaires and also from data through the Fitbit, which I think is really neat. And then we have blood collected at the time of the biopsies as well. So I think one question is, who is the study right for? I'd say that someone who is interested in finding a way of reducing the risk of breast cancer, maybe through a natural approach or through a lifestyle approach, this might be compelling for. Someone who is maybe also hoping to find a way to get engaged in exercise and to have some help in doing so, this might be a nice opportunity for them also. So we have brochures available today. We have the contact number here listed for Nicole Strauss. She's the study coordinator and can definitely give more information. I'm happy to chat with anybody about this. And I think it's a fantastic way to learn more and engage in an opportunity to hopefully lower risk over time. So thanks.